The big story that we're tracking is concerns over the black fungus cases that are emerging in India. There have been over 8,800 reported cases of the black fungus. Over 125 people have died of the black fungus in India. Now, the key drug that is used to treat black fungus is unavailable in many parts of the country. This is an injection called amphotericin B. The government has now given licenses to 5 more companies to manufacture this drug. To make sense of what is black fungus and how it affects our fight against COVID, we have with us Dr. Romel Tikku, Associate Director, Internal Medicine, Max Healthcare, joining us from the National Capital. Thanks so much, Dr. Tikku, for being with us early this morning. I want to begin by asking you, how concerned should we be about the rising cases of mucormycosis, given the fact that this is an extremely rare condition, but in India now, there are over 8,800 cases being reported?
Well, we have to be extremely concerned because this is a fatal disease, more than 50% mortality. So, and especially patients who have COVID and are diabetics and are on steroids and have uncontrolled blood sugars, they are a high risk for this. This combination is very bad. Apart from the fact that there is something more to it, apart from the fact that there are theories, there's speculation about the oxygen supplies, humidifiers, and hygiene theory, I personally feel that it has something to do with this particular strain of the virus. I mean, it might be making them more immunosuppressed, the patients. On top of that, if you're on steroids and your sugars are not under control, you are a high risk for such infection. See, mucormycosis is a very rare infection. We used to see it in the past also, but hardly a few cases. But in this way, we've seen a lot of cases. First wave also we saw a few cases, but now a lot of cases. And you can see all over India there are 8,000 cases. In Delhi there are more than 200 cases.
Right.
So one has to be very sure about management of diabetes and steroids. Indiscriminate use of steroids has probably led to this. On top of that, if you are immunocompromised and if you are above 50 years of age, because most of the patients are above 50, have some sort of immunocompromised state, whether they are transplant recipients, diabetics, cancer patients. So sugars have to be well maintained. Even after discharge, for 2 to 4 weeks, patients have to keep a track of their sugars, check their sugars with glucometer, and report any signs of facial pain, headache, nasal discharge, black colored discharge, blurring of vision. All this has to be looked into. Apart from that, unusual symptoms, like we've had 2 cases in Gangaram where we've had intestinal mucormycosis, which is like extremely rare. And both the patients were diabetics, both were above 50 years of age and needed surgery. And the index of suspicion has to be very high. The doctors have to look for this now, because especially if the patient is immunocompromised, has uncontrolled sugars, to save people, because it can be extremely fatal. And we know it needs urgent surgery. And apart from that, the medication amphotericin B is very expensive. And the treatment has to go on for at least 3 to 6 weeks and sometimes beyond that. So the index of suspicion has to be high, and patients also have to be aware. So it is something that really needs to be looked into, and the supplies of amphotericin B, everything should be available to the patients. They should not be running from pillar to post.
We'll talk a little more about what is amphotericin and this and why it's in short supply. But I want to just ask you, about who is most vulnerable. Many doctors like yourselves have reiterated that anybody with uncontrolled diabetes who has suffered from COVID and has been administered steroids for a prolonged period are at the highest risk of mucormycosis. My question therefore is, are those individuals who say don't have diabetes but have been given steroids in the treatment of COVID-19, are they also at risk?
Of course, they're also at risk if the sugars have gone up. They're not diabetics, but the sugars have gone up. They are also at a high risk, especially if they have some other immunocompromised state. But by and large, it's mostly diabetic patients, because the fluctuation of blood sugar levels is more in such patients. But if you're immunocompromised, if you've been on steroids earlier and now you're needing higher dose of steroids and your sugars are fluctuating, then you are a high risk for such infections. But having said that, doesn't happen to every other patient of COVID or every other patient of COVID who's a diabetic. But as I said, the index of suspicion should be high. Patients should be aware of what the symptoms are, because this can be fatal and involves disfiguring surgery. We have to be really very, very careful.
Right. And, the use of steroids, I mean, this is a double-edged sword, isn't it, Dr. Tikku? Because these are life-saving steroids that are being given to COVID patients to save lives. So, you know, one can't really avoid giving steroids where it's necessary. But then, you know, would you care to clarify on what is a fit case for steroids to be administered?
Well, steroids, there's enough evidence that they save lives in critical COVID patients, but there are certain indications where steroids are used. In the first week, we should not be using steroids at all because that's when the viral replication is happening. And use of steroids in the first week will increase the viral load, increase the viral replication, and eventually those patients might end up with pneumonia, respiratory failure. Initially, the steroids do mask their symptoms. The CRP might go down, fever might settle, but eventually it will create a problem. So basically, indication of steroids is when you are in respiratory distress, when your oxygen levels are falling, when you have some sort of pneumonia needing oxygen support, BiPAP. Those are the patients who need steroids. And given in the right dose for the right duration, very high dose will lead to increased blood sugar levels and make them at high risk for complications like mucor or any other secondary bacterial infection. And even the trials, the recovery trial in UK did show us benefit only in patients who needed oxygen or who were in respiratory distress. Otherwise, they might just increase the mortality when given to patients who don't need oxygen.
Doctor, the other question here is, what about individuals who have been taking or have been administered steroids for non-COVID reasons? Are they also susceptible?
Yeah, any patient who has been on steroid is susceptible, but it's not so uncommon. It's not so common. Usually it's the combination of COVID with steroids, high sugars. Otherwise, it can happen to any patient who's on steroids. But we haven't seen so many patients, as I said, in the past. So pre-COVID, we used to see maybe 1 or 2 in a month or 2. But now it's been very consistently seen in COVID patients who are diabetics or who are otherwise immunocompromised, have high sugars. So it was something which we were seeing earlier also, but not to this extent. I seriously feel that it's the virus which is making them more immunocompromised. On top of that, your sugar levels, steroids, this combination is leading to this.
All right. So it's the combination of COVID, uncontrolled diabetes and the use of steroids that makes you the most susceptible. But even if you've not had COVID and you've been given steroids, you are essentially in the vulnerable category. I want to just shift our focus from the black fungus and talk about the cases in cities like Mumbai and Delhi, Dr. Tikku, at the moment. The cases in Mumbai and Delhi both continue to decline. And this has, many heaving a sigh of relief. That the cases in cities are declining. However, the rise in cases in rural India continues to remain a huge cause of concern. Two quick questions. One is, why do you think cases are declining? Is it just because these cities have been in lockdown? And two, how do you think vaccine shortage is now going to impact our fight against COVID?
Well, I seriously feel the lockdown has helped to a large extent. We've seen it in the past also. And even if you look at Delhi or Mumbai, for the last 1 month, both the cities have been in lockdown. And it definitely helps in breaking the cycle of transmission. Otherwise, we were seeing what was happening in Delhi. It had totally overwhelmed the system. There were so many patients requiring oxygen, so many patients requiring beds. But at the right time, I think the lockdown was announced and it really helped us to a great deal. And now you can see the benefits. Over the last few weeks, there's been a consistent decline and it has reached a stage where we have 2,200 odd cases in the last 24 hours. Even the deaths have reduced. But for this, you need to break the cycle of transmission. Apart from the fact that you have to ramp up the health infrastructure, you should have more manpower, more hospital beds, more drug supplies, everything, oxygen. But apart from that, the lockdown has really helped to a large extent.
Dr.
And
Tikku,
we should...
Yes. I also want to ask you about concerns around the high number of deaths in India in the second wave. And even as we've seen cases declining, we haven't seen deaths coming down proportionately. In fact, deaths continue to be on an uptake, hovering around the 4,000 daily deaths mark. And these are just the officially reported figures. What is the situation in ICUs across different parts at the moment? Are they still patients who were infected, 15, 20 days ago at the time when cases were peaking? Are we still seeing that aftermath?
Yes, I think this particular strain has led to more severe disease and a lot of patients are requiring oxygen, and a lot of patients requiring a prolonged stay in the ICU. So severe disease causing more mortality. I think that is one of the reasons for the increased mortality. Otherwise, right now the cases are declining, but the death rate is still the same. And even in rural cities, if we don't have to look only at the metro cities, but if we go to the rural areas, maybe they're not getting enough medical aid, it's not getting diagnosed at the right time, and there might be more deaths happening there, apart from the fact that the disease has been virulent in this second wave. So that is all contributing, and there's still a challenge getting an ICU bed. It's not that easy, though it's a lot easier now.
Yes.
So a lot of people have had severe disease, and that probably is leading to more mortality.
But you know,
now that the
right. No, please complete what you were saying.
Now that the cases have declined, I'm sure in the next 2 to 4 weeks, the death rate will also decline gradually.
Right. Well, of course, you know, the uptick in deaths continues to remain a cause of concern. But it's very interesting that you're saying that, you know, while cases are declining, one shouldn't still take it lightly, because ICU beds in a lot of places are still full. And this, of course, because of the severity of the disease and the infection that we've seen in the second wave. You know, one of the other questions that medical health experts are deliberating at the moment is whether they need dedicated wings, wards, ICU facilities for patients with black fungus, given the fact that these cases are on an uptick. What is the clinical management in hospitals for these cases going to look like?
Well, it has to be a multidisciplinary approach, because you need a lot of experts in handling it, apart from the fact that you need a surgeon who can handle it, a specialized surgeon who does mucor surgeries. You also need an internal medicine person who can guide you with sugars, and then you need pulmonologists, depending on whether it's pulmonary mucor or whether it's a rhinocerebral. Then you need an ENT surgeon who does the surgery, and I mean a nephrologist if the kidney is involved. So you need a dedicated team to handle it, and a lot of hospitals are actually having dedicated wards or ICUs in handling mucor cases.
But do these patients need to be kept separately, Dr. Tikku?
It's not contagious. It's not that one person will get it from the other. You have to be immunocompromised to get it. This is not a contagious disease. But because they need specialized care, and because of the fact that they're severely immunocompromised and can get some other infection, so we have to be very careful in handling them and take precautions.
Very last question before we let you go on amphotericin B. What is amphotericin B? How crucial is it for the treatment of black fungus?
Well, it's very, very crucial. It's the main medication which is used, apart from the other two oral medications, posaconazole, etc., which are used. But amphotericin B is very, very effective. It's very expensive, and the best form of treatment for such cases, the liposomal amphotericin B is the one which is the most useful. It's renal friendly, has less side effects, but it's very expensive. The amphotericin B deoxycholate is the other formulation of amphotericin B which can be used. It's cheaper but can cause a little more side effects. And then there's the lipid suspicions of amphotericin B. So there are 3-4 variants which are used, but liposomal remains our best bet. It is expensive, but it's very effective, is renal friendly, has least of side effects.
And it's an injection.
Yeah, it's an injection and has to be used for a prolonged period, 3 to 6 months.
3 to 6 months?
I'm sorry, 3 to 6 weeks, but in
6
certain
weeks.
cases beyond that also.
Right.
And also the fact that, see, to prevent mucor from happening, you have to prevent yourselves from getting COVID. That is the bottom line. And coming to your previous question, which I didn't answer, was about the vaccines.
Yes.
So we have to ramp up our vaccination. We have to be very aggressive. We have to have more and more vaccines in place now. I'm sure in the next few months we might have Pfizer, Johnson & Johnson, Novavax and other vaccines also. But there should be no hesitation. There's enough data now which says that even if you get it post-vaccination in breakthrough cases, the disease might not be very severe and the mortality is very low. So we have to be aggressive. It should be available everywhere. And all of us have to focus on vaccination in the next few months now. There is speculation about the third wave, but it's all speculation. Nobody knows whether it will happen, not happen. Children will get affected, not get infected. I mean, that's all theory. But bottom line is that to prevent from any further surge or spike, we have to follow code-appropriate behavior and be very aggressive with vaccination now.
Well, I think that's really important because while we talk about black fungus, it's important to note that ultimately the rise in cases of black fungus are also linked to COVID. So preventing black fungus has a lot to do with preventing COVID, and it all really boils down to vaccinations at this point, Dr. Tikku. And I think that's a very, very important connection that you've made as well. It's unfortunate there is a shortage of vaccine supply. 18 to 44 age group, for instance, in Delhi is not going to be vaccinated from today because the government says it just doesn't have enough vaccines. We will continue to keep a close watch, though, on all of these developments. Thanks so much for your time this morning, Dr. Tikku.
Thank you.